Okay, we're back. The Inner Champion Summit. This topic, helping relieve trauma as it comes up. It's very challenging to do in the moment, but there are some things that you can help yourself with that Dr. Rimka is going to help with. Before we get to that, there's an important, in fairness to you, note we need to add into this summit as we are teaching various skills for you to help yourself with your inner strengths. And again, being able to help yourself, we want to acknowledge that there are traumas and inner struggles that there's a range of levels of trauma, levels of challenge. And there are some that are easier for us to handle with some of the skills we're teaching in this summit than others. There are some where you definitely need more help from someone teaching you the skills, and sometimes even the full-on clinical side of support. And Dr. Stephanie Rimka, I brought in for this topic. She's very, very invested, by the way. She's very passionately cares about truly helping people in these ways and for them to be able to help themselves with their traumas. And so she's a holistic medical doctor, but she's a really fun distinction I want to celebrate here is her clinic in Atlanta received Best Mental Health Clinic in Atlanta, received that award. So that's pretty cool. But anyway, so that's the caliber of specialization and expertise she's bringing to the table here. So thank you, Dr. Stephanie Rimka, for joining in.
It's my pleasure to be here to help people, and thank you for your kind words and knowing that I do this from a very genuine place. I wanted the money, I would have went into plastics. Trauma is a tough place to be, like a niche to have, stress and trauma, right? And trauma, you have to remember, is anything. I want to make a very clear distinction so people understand. Stress is not trauma, right? Trauma is anything that overwhelms the nervous system in an energetic way. It is a true biological energy crisis. It is not thinking. It is unconscious and out of your control. And there's a very wide range of what happens to people that can lead to trauma. You can have 10 people lined up, the exact same situation, the exact same thing happened, and only 2 end up in a physiological state of trauma. The rest just endured high stress, but their system was stronger biologically, energetic, in true energy measurement form than the other 2 that dipped into trauma. So they are not the same thing. Stress, people often want to treat trauma the same as they do stress, chronic stress. They're not. That is a huge mistake that all clinicians make, whether you're doing a biological situation, looking at a physical condition, symptomology, trying to symptom suppress, or if you're in a talk therapy type thing. So I love the inner champion and understanding that the power is always within you. I heal no one except myself. My job is to guide people. I don't want to be their guru. I don't want to be their hero. I don't want to be their healer. I cannot stand the hubris that goes into people saying, I'm a healer. No, I'm not, except for myself. I am my own healer. That is it. Everybody else, I'm trying to teach and guide them to understand how to tap into the resource of their own inner healer. You are the guru for which you seek externally. And I'm just there to teach them to learn to listen to a language the nervous system is speaking that is so foreign to you. You think you have a disorder. You just don't understand the language. Once you become fluent in the language the body is giving you, which is absolutely ordered and completely normal, you will stop thinking of yourself as sick, broken, crazy, and understand you just needed to learn how to listen to a language you didn't know what to do with. Most of the time, people need a trained facilitator, teacher, guide, therapist, clinician, whatever you want to call it, to learn how to do that. Once they're fluent, they can access and understand. I am the inner champion because I can speak the language. I understand what I'm saying to myself. So that can often take a lot of time to reteach this, and even the concept from the years of pounding the gaslighting or the medical dogma that teaches you're broken and crazy and this is permanent and you just got to live with it and we're going to drug you down and make you numb. That might take me 6 months to be able to access to that brainwashing just so I can even start the process with somebody. Does that make sense? To retrain them, deprogram them.
Yeah,
Right.
and before we continue, to your point with the nervous system, the importance of it, there's such an importance in the nervous system and helping the nervous system.
Yeah.
Within helping yourself. And it's so little understood and talked about.
Yeah.
Compared to most modalities of helping oneself, that I lined up 3 topics that we're coming at it 3 different ways. 3 of the interviews in this series are for helping the nervous system because it is that important.
It's the foundation of every
Yeah.
dis-ease, symptom, illness you have. I don't care what supplements you take, what therapies you do, what modalities. If we are not addressing the underlying hyperarousal activation of the fight or flight nervous system, you will heal from nothing. This is the most important thing to get a hold of. If you are comfortable, I'm sorry about my dog, but he's starting to bark at something. Could I share my screen and show a very quick, I'm extremely visual. And I think if people see things visually, it'll help them. And this is just a little bit of a PowerPoint that I did 2 weeks ago in Dallas for 2,000 doctors about the hidden barrier to healing is trauma. And they really don't understand it. I can just spend 5 minutes, Akalon, and I can show them so they can at least have this and then reference these pictures of,
Yeah.
Okay, are you
100%? I just enabled screen share. Go for it. Thank you.
All right, so let me do this real fast. Everybody gonna talk, right? About the nervous system so people can have a visual and it won't sound so woo-woo or whatever. So is this okay? I'm just gonna do it like this. I'm not gonna do that. So
excellent.
Again, as you can see, this goes 13 slides into a talk. So we're just gonna kind of bang through it, but there's a real biology to this. This is an autonomic nervous system body map. This is not stinking thinking. This is unconscious. This is automatic. And it is non-verbal. This is going to happen regardless whether what you're thinking. So this is why my premise, I'm going to come at it from a neuroscience basis and say stress and trauma is non-cognitive. That is not what Western Rockefeller medicine teaches you. Almost all talk therapies are extremely cognitive. You're talking. And cognitive behavioral therapy, it's right in the name. So to them, the way of thinking, and I'm not saying there's not importance to that, but you aren't going to use affirmations to get yourself out of trauma. It's not going to work because this is what the technique we'll get to the TRE, the trauma releasing exercising, and understanding somatic and bioenergetic therapies deal with the body because we're not dealing with words. And we're taking the cortical part of the brain, this big part that does all this conscious thinking and consciously doing stuff, and we're going subcortical. That's what the autonomic nervous system is. It's subcortical, it's automatic. You are not in control. And thank goodness you don't have to keep track of your heart rate, your breathing, your dilation, body temperature, muscle contraction. If you were in charge of this, we would last 37 seconds on Earth, okay? Because we could not handle how many things are going on, trillions of decisions, right? So what I want you to think of is, so activation meaning fear, right? And or the body, the way the body responds, and threat is what goes on. So let's say, pick a thing, a gazelle on a plane, a lion, it hears something or sees something, it perks up. That's going to be the activation we're going to talk about. And I want you to think of it like a marble on this track, right? The marble's always seeking the most stable place to go. And this is what we understand. The body has made these adaptive states for benefit for us. It's not disordered. It's not stupid. It is never making a mistake. If you feel like you're about to have a panic attack, there's an ordered reason for it, okay? Like you just aren't here, you've ignored some other messages to you for a while. That's what I'll basically say, okay? So state 1, mild stress. A lot of people are very familiar with this, very stable. So the gazelle thinks something very calm here, neutral. There's something in the corner. What is that? We rise here. Either we're going to go back down to 0 or actually to this adaptive trough to be held in a little bit of an activated state keeps the gazelle alive. It's, oh, there was nothing there, but I don't know. I think we need to be a little bit on alert now. So this is more energy, a little bit of anxiety, maybe some fear. You're a little bit hyper alert. Humans can express this like anger, irritability. Our breathing changes, our heart rate changes, but we can stay here. It's like driving on an icy road. Okay, there's a storm. Your whole physiology changes as it should to keep you alive so you can react faster in a very dangerous driving situation. Okay, you aren't as chill anymore. Not a disorder, very good for you. So if something happens, you can spike up very quickly. Oops, I forget it's not a power, it's not, I have to click things. You can spike up very quickly because it's much less energy to go from here to here. Now this is maximum stress. This is this is stress, mild stress, high stress, okay? We're not in trauma here. But this is short. And so you see, we can stay here for quite a little bit of a time, actually. This is fight or flight, right? We are running out there, we are dealing with it, or we're fighting something off. Ultimately, the system is going to break down. The thing that's in charge of this inside your cell, there's a few things, but we'll focus on the mitochondria. This is the core of your cell, creating all the structured water, hydration, signal molecules, energy. It's dependent upon sunlight. So the worst people in being outside, there's a lot that goes into this incredible bacteria. It is not human. It has entirely separate DNA. We're in a symbiotic co-relationship with these things, right? They keep us alive. We can last for a few seconds without these things functioning. We die very quickly if they don't work, much faster than oxygen, okay? So these are the things that drain it. So how you eat, things that are in your subconscious, stories you're telling yourself during age makes total sense. A 7-year-old child cannot handle what a 40-year-old can handle physically or emotionally. They just cannot. That's very obvious, right? But toxins can do this to the system, right? So what that looks like is this. So now we go from stress to panic. We can hyperventilate, we can sweat, we can shake, right? So it's not anger, it's rage. So people who hang out here a lot can dip here very fast because like, oh, we can be the common word triggered. Okay, people say like very quickly, we're like, wow, that's a big reaction. And you'll know because you might yell at your kids for something really stupid. And you're like, okay, that I did overreact. Mommy needs a time out. Mommy needs a way to dissipate this level of stress that she's been in. You can stay in state 1 for years. All right, you can't stay here for years, but you go back and forth. Okay, so people with panic attack disorders, let's say, they're here and here, they just dip up throughout the day, right? So how that plays out is something, the body becomes rigid and hard and it gets a calcium shell, we call it, because stress leads to chronic breakdown of the body. It breaks down the bone, it leads to chronic inflammation and makes you physically and emotionally walled off. It looks like this. So stress, chronic stress does lead to weak bones, leads to osteoporosis. It leads to many things, breaking down muscle, ripping things apart. But calcium deposits in your soft tissues, your joints, your fascia, and the muscles. This is important because I think you must do techniques on the body to get that out, or you're never going to get out of these stress and trauma shells that you're in that are keeping you disconnected, always feeling anxious, numbed out, having very low neurotransmitters that bring you good feelings. So it's why people who have very low neurotransmitters and have a calcium shell from stress go to drugs, alcohol, shopping, Instagram, TikTok, whatever, because they are physically so depleted. They're searching for something to make them feel good. It's a real biological issue. Okay. I put it all together. It looks like that. You just screenshot it. Okay. So this is what happens. This is the overwhelm point. It's a crisis. Here we've been hot. These are called hot symptoms. This is where therapy works really well. This is where your breathing techniques, your tapping, all your little things work really well to lower anxiety, discharge some electricity that's gone high. Okay. This is when there's an energy crisis. This is a mitochondrial disorder, and we drop below the activation line. We are in energy deficit. This is very different. This is where the body gets tired, heavy, sleepy. The body will collapse. We go from tight muscles to low tone. Can't do the same thing. You're not like this. You're like, oh, Okay, very different. This is like taking a cold, wet blanket and putting it on top of the fire of 1 and 2, however, because you can have state 1 and 2 symptoms happening here. People are often misdiagnosed as having bipolar disorder here because you cycle off and on between hot and cold symptoms. Anytime there's a cycling of hot and cold symptoms, any psychologist, psychiatrist calls it bipolar and puts you on bipolar meds. Okay? But this is what's going on. There are real physical issues here that are constantly misdiagnosed as something else because physicians don't understand how to look for, and trauma and regular talk therapists, unless they're trauma therapists, are not trained in the biology of this. Okay.
Mm-hmm.
So these are some of the things and some of the why what you eat matters. I could talk for 5 hours just on nutrition to overcome mental health disorders, but we don't have time for that. Let's look at this. So there's still hope, right? This is you see the lion, you run from the lion. The lion grabs you by the neck. You are down on the ground here, okay? Not looking good, but that lion might walk away. So you dissociate, you numb away from your body, you go numb. You're flooded with chemicals to collapse you so you don't fight anymore. The lion might pick up and go. And that's why you still have hot symptoms and you can activate yourself and get back up into again and try and get away from what happened. And okay. This though, however, the lion's got me on the ground and 5 of its buddies walk over. I'm screwed. This is dinner. I'm done. So there's full dissociation. State 4, total numbness, actually blank, often feels good. People, it's a relief because I now have DMT, morphine, there's more heroin type drugs going through my system. I'm in la land. And actually these people can actually feel like they're in state 0 because this is a relief from depression and hopelessness. This is hopeless. This is floating. This feels high. It feels good. Diagnoses that can walk in my office like this are dissociative identity disorder, complex PTSD, borderline personality. Okay, this might be depression or bipolar. So the big thing you have to understand here is that this is an energy crisis. This is a biological energy crisis. You must refill and nurture this body system. Trying to talk and do things here to pull yourself here is very hard. This usually requires, yeah.
To your point, when we talked about this earlier, so it's a good point to mention, in fairness to you, when you're going through this, you meaning the listener, the viewer here, it's a reason to not feel bad for when you're struggling.
Correct.
Don't beat up on yourself if, okay, I'm trying this technique and this method and this, and
it might be the wrong thing for where you are. Yeah, I don't ask these patients to work out. This is not exercise. Mm-hmm. This is exercise. You're in high stress, you're having a panic attack, go run 10 miles. I promise you, you will have no energy left for all that nonsense. That is the nervous system trying to discharge energy. It is trying to get it out of you because you should be fighting people off or running from an animal. That's literally all that should be happening. But we get this over student loan debt, mortgage, a divorce. It's not that these things aren't stressful. A sick child, a dying parent. This is outrageously stressful for the human system. Isolation, loneliness, the whole scamdemic separation and isolation of humans from each other, not touching, is stressful. Mm-hmm. This caused this, and some people's system collapsed into trauma. A lot of people were collapsed into trauma because it was a biological drain. You aren't doing anything wrong in your mind. This is normal, not a disorder. It's just maybe you often we're stopping the discharge is the problem because we're uncomfortable. So this is a much longer talk and I go into it, but I wanted you at least them to see this. The key is you have to reverse this process. If you're from 4 to 3 and 3 to 2, most likely you need a therapist, someone to help you because they're working so desperate. You don't feel safe. You're not supposed to because you've been overwhelmed. You've been overtaken. Why would the gazelle surrounded by 6 lions? It doesn't have a fighting chance. So what you need is the therapist to come in with a big shotgun and start taking lions out for you and to say, you're safe. And your whole system's, what the hell just happened? And We have to put nutrient. I physically feed my patients. A lot of this is where supplements and certain things come into place to rebuild a nervous system and doing things that help you bring aliveness and energy back. This is where standing outside, grounding. This is sunlight. This is good nutrition. This is letting yourself rest. This is being okay with, I walked to the mailbox today and got the mail. And you know what? Check it off my list. I did something. Yay, me. You can't compare yourself to when you were in state one and you were able to do 100 things a day. If you're here and you can get 1 or 2 things done, that's extraordinary. I have some patients, we have to applaud them for taking a bath. And as I keep applauding them for these basics, they go up, the energy builds up and I can get them above the line. Okay.
And with the inner champion way, you would celebrate those victories in that condition.
Correct.
Do count. They do matter.
They're extraordinarily important.
Celebrate.
I'll stop sharing, but I wanted to at least, I'll say this, the big key is that we use body sensations, getting connected to the body again, associated, and having awareness of that leads to the ultimate embodiment. Below that line, right, we're numb and dissociated. This is why meditation and yoga don't work often for these people. They can make things worse for some people. A lot of techniques that work here are counterproductive. So you have to be aware. So that the technique we'll talk about TRE, the body's natural genetic encoded healing response to do this. You still want to do it with a trained clinician because this can be tricky and you could be using a technique just actually accentuating dissociation. People can use meditation to further and enhance the neuroplastic ability to dissociate. It happens all the time. They're using meditation as dissociation.
We wanted them to know what you're leading into, but we were going to give them something to work with.
Something to do?
Yeah.
Okay, cool. So I got how many minutes?
2.
All right. So I'm going to show you this. So I'm going to go through something really fast. Now so the technique, and hopefully you'll put a link about TRE and they can understand, there's a very specific technique, but these are some things you can do anytime. This is something I would do when you're alone because you can't really do it in the office, but you could do it with your kids. All right. So can you see my feet? Oh yeah, make sure you see my feet.
And you can drop the link for that in the chat.
Okay. These are a few grounding techniques, and believe it or not, people don't do this enough, and it's going to be loud. So you would do this alone where you feel safe and comfortable. There's 3 things. So basically you can have a temper tantrum. Then you're going to kick your heels out, like kind of karate kicking and stuff. And then we lead that. It's one. We're going to temper tantrum, heel kick, heel the ground, and then we'll kick. So Pookie, you
And this is to release the charge?
This will be to deal with charge. So this isn't exactly trauma, but this is leading into the shaking and movement, understanding that. So everybody knows this. So first thing, the idea is discharging electricity that's building up in the body, especially the head. That's where the anxiety, the racing mind, we want to get it into the earth. We want to discharge. So every little 3-year-old knows how to do this. Ready? I'm going to do it real fast. And I want you to breathe through your mouth, open the mouth, and make noise because you'll be alone. Who cares what you look like?
I'm going to do this along with you. I'm going to follow along.
Ready? Yep. We're going to stomp. Oh. Oh. Every kid knows. Hit it. I want you to go into it fully and put it into the earth. You aren't hurting anybody. You can't hurt anybody doing this, right? So many of you are too concerned with being nice. And you haven't been able to use your vocal cords either to tell somebody to F off or leave me alone or no. Because you couldn't do that, you're going to practice this. You could just say also, no, right? For many women, that might bring up some things. Let it come out, let it shake, let it cry. And if you're feeling this, just go. Then you can go with it, do that for like minutes. Then you go with the heel, right? We just want to heal it and sing. And then you can just start kicking because basically at some point you wanted to fight and you weren't allowed to do it. You were told, no, be a nice little girl. Good boys don't do that. Whatever the hell you were told, get it out. All right. Then it's pretty much, you just want to then ground into your body after doing this. Knees slightly bent. And you just let yourself feel your legs. You're basically bringing strength back into the bottom, into your root. go into the ground, discharge it. You could then even picture water pouring into your head, or white or light, golden light coming in and washing it all into the earth. Just take it away. Ugh. And you'll breathe through the mouth. The jaw is containing a ton of energy. I want, every kid knows. So that was an extremely accelerated. If you would spend 2 or 3 minutes doing each of those, and then stand at the end, very grounded, feet parallel to the hips, breathing in and out through the mouth, letting it be. The more you can get it out, you'll be surprised. And please, if your body wants to shake, wants to tremor, wants to cry, I deeply encourage you to let it go, because that is your nervous system saying thank you, because you've made me feel safe enough to get this out. It wants to discharge this old stuff that's stuck. And so that's just those are some bioenergetic exercises around grounding and getting some picture. Again, you want all that electricity that's building up in your mind to get it out, push it down, push it into the earth that way, and and even no, stop. If these words come up for you, let them out, because at some point you wanted to say them and you were too frightened. Right? And you might feel like a 6-year-old. You might feel like a 2-year-old. You might be 13 when you're doing this. Good. Okay. So anyway, there's that.
Awesome. And so we're at the end, but so that's
I hope that was helpful.
Very well. And that was an example. I mentioned earlier in the previous interview that my kung fu teacher taught to, rather than repress, to let things come up, to be honored, loved, addressed, released.
Yeah.
And
women are very much taught never to do this, though. They're
Right.
taught you're not supposed to fight, you're not supposed to punch,
Right.
you're not supposed to kick, you certainly don't speak it. So this is a way to practice it. When you're
Exactly.
really pissed off at someone, you do this and you'll feel a lot better.
Very good. Very good.
Right.
The link was dropped. Just tell them real quick what that's to for that system.
What link did we put in? What'd you do?
I forget the acronym. You mentioned the
PRE?
Yeah.
Did I put it in or you put it in?
We did. The link you gave us.
Oh, okay. Was it trauma prevention? Or my website? I don't know I don't remember what we gave you. It's for stress and trauma releasing exercises, a series of exercises and shaking technique methodology to teach your nervous system how to do this.
Hasnain, did you put the link in the chat? I'm not seeing it.
It's traumaprevention.com
Okay.
is the general website, and you would
Okay.
find certified clinicians there. I'm one of them. I'm one of many all over the world. So if you wanted to work with me, you would go to drrimka.com. We do it virtually, and I have group sessions and things like that. So you can do private sessions, group sessions, and then once you know how to do it, you can do it anywhere you want at home, all alone. But we do want you to be with a certified practitioner for a few times to make sure we can guide you through, help you feel safe and comfortable. You always want to be safe and comfortable when you do these things.
Yeah, it helps to have someone that can support that.
Yeah, I'm much safer if I have a trained professional I trust that I can let myself go with. Yeah.
Hasnain, are you there? Did you put the link in the chat? We don't see it.
I see it. Traumaprevention.com.
Oh, perfect. Okay.
Or TRE. And you
there it is. There it is. Yeah.
People all over the world.
Yeah.
Awesome.
Okay. Thanks for helping with this. It's crucial for people to have an understanding and ability to help themselves on this level.
Yeah.
And rather than bypass it. So thank you for bringing that expertise in.
I'm glad. I hope it helps all the other speakers so people can visualize it now.
Yep.
Awesome. Thank you.